This is famous ophthalmologist Dr. Nima. This is her 6th-year ophthalmology resident, Dr. Stalin. This is 20-year-old Justin, who is very concerned for his eyesight.
Hello, I'm Dr. Nima and this is my student Stalin and he'll be with us today.
Hi, my name is Stalin.
Hi there, Doctor. My name is Justin.
Okay, Justin, how old are you?
I am 20 years old.
Okay, I'm gonna need some personal information, but before I get there, I want to know what brought you here today.
Well, the past few days I've had blurry vision and I struggle to see sometimes.
Okay, do you struggle when you look at bright lights or something like that? Does it hurt your eyes?
Yes, when I look at bright lights it tends to hurt, so I avoid looking at bright lights.
Alright, but do you notice any changes while looking at the bright lights?
Yes, I see these circular shapes appearing when I look at bright lights.
Do you have any headaches?
Yes, I usually get headaches when I have pain in my eyes as well.
Do you rub your eyes a lot, say a few times in an hour or something?
Yes, quite often, but only when it gets irritated.
Because Justin, sometimes rubbing your eyes can cause pain and irritation to your eyes, and they're similar to the symptoms that you mentioned.
Okay, I'll try to stop rubbing my eyes in that case.
So, do you know any family history, any diseases that runs in your family to do with their eyes or other health problems?
My father had some sort of problem with his eyes, but I don't quite remember what it was.
Were they similar to what you have now?
Maybe he did complain about headaches and having a sore eye quite a lot.
Stalin, do you have any additional questions you want to ask the patient?
Are you perhaps allergic to something?
I don't think so, not that I'm aware of.
Okay, so can I take a look at your eyes?
Yes, that's fine.
Okay, Stalin, I need you to have a look at Justin's eyes as well closely.
The cornea seems to be a different shape.
So do you think you can give me a diagnosis?
I'm not quite sure.
So I can see that your eyes have cone-shaped cornea, which is normally seen in patients with keratoconus.
Okay. Are you sure?
From the symptoms that you mentioned, they're similar to the symptoms that are normally seen in patients with keratoconus, but I would like to run some few tests before I confirm it. So Stalin, do you know any tests that can confirm his diagnosis?
Corneal topography and slit lamp exam.
Yes, you're right. So as he mentioned, like I said, the tests that we'd like to run are called corneal topography and slit lamp exam.
Okay.
The cornea is the front transparent surface of the eye through which we see. Corneal topography refers to the technology for measuring the shape of the cornea. Basically, a series of bright rings known as placido rings are projected onto the cornea. A camera takes a picture of the reflection. A computer is then used to analyze the distortions in the reflections. Finally, the distortions are then converted into a color-coded map that can be printed out.
And increase the angle between the illumination system and observation system from 45 degrees to 60 degrees. This will help us to improve the resolution of the image seen on the cornea. Increasing the magnification will allow us to see the three main layers of the cornea.
Okay, Justin, so the treatment that will be done is called corneal collagen cross-linking, and it's just a one-time procedure. So what we'll be doing is putting some vitamin B solution into the eye, and it will then be activated by UV ray light for about 30 minutes or less. But what you need to know is that while you do get the treatment, but it doesn't make the cornea entirely normal again, and it can keep your vision from getting worse, and in some cases it can improve vision. And the procedure may require the removal of the outer layer of the cornea, which is called epithelium, and it's for the medicine which is called riboflavin to easily penetrate into the corneal tissue. So it's a bit medical.
A LASIK flap is created using a femtosecond laser or microkeratome. The flap is lifted. A normal excimer ablation is performed. Sufficient Vibex riboflavin is applied to cover the entire exposed corneal bed and allowed to diffuse.
Thank you.
My pleasure. And try to avoid touching your eyes and come back if you have any more symptoms. Bye-bye.
Yeah, okay, I'll try to stop touching my eyes. Thank you again.